Good afternoon and welcome to the HL7 Vinci Community Roundtable. Today's session, Transforming Healthcare End-to-End Data Conversations. My name is Alex Goss, and it is my pleasure to moderate today's Community Roundtable and to remind all of us that we engage in these forums under HL7's antitrust policies to ensure appropriate collaboration and information sharing. Today's session delves into how two Da Vinci member organizations are working together to transform payer and provider data conversations with a sprinkle of HL7 FHIR-based magic. We'll explore the ins and outs of coverage requirements discovery, CRD, documentation templates and rules, DTR, prior authorization support, PAS, clinical data exchange, CDex, and data exchange for quality measures, or DEQM, including gaps in care. After a few program updates, our presenters will set the stage with sharing their use of Da Vinci implementation guides as foundational standards in their proof of concept accomplishments and how they're making healthcare data interoperability not just a goal, but a reality. You'll learn how these industry partners and leaders are leveraging Smart on FHIR to create a unified, single solution that meets providers and payers where they are, ensuring seamless and end-to-end data conversations. Our presenters include Rob Brohl, Senior Product Director from Infor, Allison Slatton, Portfolio Program Manager from Cognizant, and Janie Miller, Solution Owner, also from Cognizant. I encourage you to use the question function in Zoom platform today throughout the event to submit your questions. We've also muted your lines to ensure the quality recording of today's event, and there will be a survey launched at the end of the webinar, and we really appreciate your feedback as it helps us with programming and continuing to evolve the quality content we deliver to you through the Community Roundtable. The recording of today's event, along with the slides, will be posted. Along the way, Leslie Ambrose will also be pushing out into the chat feature, various links to help you and assist in locating other resources you may find of interest. You'll also be able to download those chats so you can easily save those links. The Community Roundtable schedule will take a hiatus in April due to the Da Vinci April event that I'll be talking about in a moment. So we will next meet for the Community Roundtable on May 28th at 4 p.m. We hope to see you at that webinar. And in the meantime, please check out our prior recordings and slides for additional resources that may help you on your FHIR-based journey. Regarding upcoming events, from an industry perspective, NACO's spring event, the National Association of ACOs, will have their 2025 spring conference in Baltimore the week of April 22nd. There's a WEDI 2025 spring conference, May 19th to the 22nd, which is virtual. And AHIP 2025 is meeting in Vegas, June 16th through the 18th. For the HL7 side of the house, we'll be having the HL7 Da Vinci Project Training and Testing event. It's a virtual-only event, which I'll describe in more details momentarily. The May Working Group meeting for HL7 and its FHIR Connect-a-thon for the May session will be held in Madrid, Spain, May 10th through the 16th. The 2025 Da Vinci Project Roadmap encapsulates our program priorities in this timeline view. We're very focused on implementer support and advancing pilot projects, and we'll continue our storytelling of implementation successes and lessons learned to aid the implementers through this community roundtable and other activities such as our Trebuchet FHIR pilots, for example. With that context of our priorities on implementers, I wanted to dive a little bit more into the implementer resources so that you're aware of key educational and reference material that you can tap into, such as our implementer support page that gives you a view of things you need to know from a FHIR perspective, reading an implementation guide, or thinking about the toolbox you might need as a developer or a business analyst. Our video presentations provide recordings not only from the community roundtable, but also from other events such as HIMSS presentations and other stages where Da Vinci is presenting. And our Da Vinci Trebuchet efforts are increasing the volumes of recordings to help implementer communities and the cohorts of pilots advance their important work. So there's a link there to also help you with finding those resources. In regards to our upcoming Da Vinci Spring event being held April 22nd to the 24th, this is really designed to help you and your team come together to figure out the best approach, to inform your best approach for automating workflow, maximizing strategic value and efficiency while meeting those federal requirements of CMS interoperability and prior authorization final rule, which we affectionately refer to as 0057. The format of this event is to have 2 days of interactive content delivering and demonstrations, followed by the third day of collaborative testing event that provides implementers and developers with the opportunity to test FHIR-based solutions and exchange data with other FHIR interfaces. Although there are 3 tracks that are offered, I'm going to break down for you a little bit more about how those are organized. We encourage teams to attend. We also want to make sure folks that are aware that if you're looking for some deeper dive education related to the FHIR technologies, you can access those via HL7's Education on Demand portal, and anyone registered for the event will get a discount towards those training opportunities. We encourage you to learn more and register now as the early bird rate ends on Tuesday, March 31st. If you are an HL7 or Da Vinci member, you will qualify for the member discounted early bird rates. And make sure if you're a Da Vinci member that are not HL7 members to get that coupon code from HL7 so you can get that discount. And I stand corrected, it is Monday, March 31st for the early bird rate. There are options for you to pick from for your participation level. You can certainly register for the 3 days of the event, which kicks off with a business track, breaks into technical tracks before going to the testing event. Or you could buy a 1-day ticket for Tuesday or Wednesday to cover those educational tracks, or just participate in the 1-day Connect-a-thon. You can also bring a group of folks and get a discount opportunity for more than 3 registrants for the Connect-a-thon 1-day only ticket. I wanted to give you a sense of the overall agenda and curriculum for this training. The full schedule is viewable with session objectives and speakers via the link that will be provided to you. We're going to kick off day 1 with everybody in the same session to just have a keynote panel of harnessing Da Vinci implementation guides to meet 0057, really focusing on success stories and strategic insights before diving deeper into the value of the return on investment of automation with FHIR in healthcare. Wrapping up with some product demonstrations that start of the first day. And then we're going to have folks self-select whether they want to go to the business track, focus on burden reduction technical track, or the payer data exchange technical track. This will help you take a deeper dive in the business track into empowering your implementation and hearing from the trailblazers that have actually implemented payer data exchange and the burden reduction implementation guide suite, coverage requirements discovery, documentation templates and rules, prior authorization support with some clinical data exchange peppered in. On the burden reduction technical track, they'll talk about workflows, achieving conformance and optimization strategies, and questionnaires. The payer data exchange is going to focus initially on benefits to patients and enabling data exchange from payer to payer or data exchange using PDEX, and also looking at member matching and establishing treatment relationships with Provider Access API. On day 2, we break into only the technical tracks between burden reduction and payer data exchange, really helping dive into enforcement discretion, benefits beyond compliance, and having an open forum discussion for the burden reduction track up until lunch. And on the PDEX side, they'll have a focus on patient access APIs, provenance, and payer data exchange open forum. The two technical tracks come together for the finishing out our day 2, looking at not only some product demonstrations, but secure access at scale, prior authorization in the patient access API, terminology translations, and also diving into the metrics that can be captured as a part of the burden reduction and patient access APIs. That'll lead into day 3 of testing. So we certainly hope that you will consider signing up for that event. It should be a fantastic opportunity for folks to learn more and collaborate with their teammates in a forum that will help them garner lessons learned and be better prepared to chart their implementation journey within their operational units and technical resources. So without further ado, I would like to invite Rob Burrell, a Senior Product Director from Infor, to come on screen. I'm also going to have Janie take over. Allison's going to start screen sharing, and they're going to provide you with an overview of their journey. And I look forward to coming back and having some Q&A with you. So please send in your questions as they pop up throughout today's presentation. Rob?
Thank you, and thank you so much for having us. And so I'll be leading the first part of the presentation. We'll break this out into 3 sections. So I'll be covering the first section, and then Allison is going to cover her section, and then Janie will wrap it up for the day. All right, so let's get started. And when I cover my part, I'll be talking about the standards. And so we'll review some of the implementation guides that Infor and Cognizant have been working on together in collaboration. And so we'll go over those just to kind of level set. And then Allison will take over and talk about solutions and discuss burden reduction integration and even do a demo. And then Allison's going to finish up the day with Janie's going to finish up the day with strategic direction, building adaptable implementations on a foundational framework to extend to additional use cases and data flows related to these implementation guides. So next slide. And to start things off, I'm going to be going through these implementation guides that we'll be discussing. I'm going to be using some of the same slides that were used in the January community roundtable. I will not go into as much detail as Lloyd did on that day, but just want to do more of a high-level overview so that we all have the implementation guides fresh in our minds before we go into more details with the solutions and the strategic. So I'll be talking about coverage requirements discovery, CRD, documentation templates and rules, DTR, and prior authorization paths, along with CDex as it relates to prior authorization, all those being a part of the burden reduction family. And then I'll also talk about data exchange for quality and measures, and specifically gaps in care within the DEQM implementation guide. So let's start off with burden reduction. So burden reduction has 4 implementation guides associated with it. CRD, DTR, and PAS have always been a part of burden reduction. CDex has fallen into the burden reduction umbrella with one specific workflow related to PAS. So we'll go through all these implementation guides in more detail. All these, or the first 3 of these implementation guides, CRD, DTR, and PAS, are recommended within the CMS 0057-F final rule. And then also within that rule, if you'll click next slide, there is enforcement discretion around prior authorization approval, or enforcement discretion around X12, which allows prior authorization approval to happen at the CRD and DTR steps. So that the X12 enforcement discretion allows the prior authorization to take place without X12 being used, which means that, any time within these implementation guides that the payer determines that they have the ability to make a decision on approving prior auth, they now have the ability to do that. And so let's talk in more detail about CRD. So CRD in particular, on the next slide, is what triggers the whole process. So you have a CDS hook that sits within the EHR technology. This could be, for example, an order sign that would trigger the whole process. That CDS hook's request would go over to the payer with information about the order and other related information that would allow the payer to make a decision about coverage. Is it covered? Is it not covered? Or is prior authorization required? So if the response is it's covered or it's not covered, then we can stop at the CRD step. If prior authorization is required, then they may determine that they already have enough information to give that prior authorization approval. And if so, they can give the prior authorization approval now, and we will be done with just doing CRD. If it is determined that there is more documentation needed for prior authorization, that would take us to the next step, which is DTR. And so with DTR, this is the phase that allows the payer to gather more information using a questionnaire resource. So if CRD ends with prior authorization is required, the clinician would receive that response back and then be prompted to open a Smart on FHIR app that would allow them to answer questions from the payer. The Smart on FHIR app would go get a questionnaire resource from the payer and display that to the clinician. And then also within that questionnaire resource is CQL logic, clinical quality language logic, that tells the app where to go fetch that data from in the EHR's FHIR server. So hopefully when that questionnaire is rendered in front of the clinician, a lot of the information is populated already. Any information that's not populated, the clinician can then fill in that information and save that as a questionnaire response resource. That's one way of doing DTR. There's also what's called an adaptive forms way of doing DTR, which allows a series of questions to be asked. So you would get an initial questionnaire with either one or more questions. You would answer those questions, and then that would initiate a next questionnaire and a next questionnaire until all the more specific questions that the payer wants answered are answered. And that would be the second way of handling DTR and getting those questions answered. If by using those adaptive forms, the payer can determine or make its way to a specific answer based on more detailed questions that are targeted towards the previous answers, then they could do prior authorization approval at this point. If prior authorization is not approved, the questionnaire response resource is saved, and then that would take us to the next step, which is the official prior authorization submittal, or PAS. And so with PAS, this is where the prior authorization is officially submitted. By default, or I guess one way to do it, would be that FHIR bundle is created with the questionnaire response resource, with the claim resource, and with all the other relevant information related to the order. That would be sent to an intermediary, which would convert the FHIR bundle to an X12278 request. The X12278 request would go to the payer. They would respond back with the X12278 response. And then the intermediary would again convert that back to FHIR to a FHIR claim response bundle, which would then go back to the EHR with the determination of either approved, denied, or pending. So that would be one way of doing it. But as we talked about earlier, go on to next slide. And then one more time. There's also the opportunity that if the payer wants to use FHIR or has the capabilities within their infrastructure to use FHIR, that the FHIR bundle could just pass straight through to the payer. And so in that particular case, you don't necessarily need an intermediary. If you had an intermediary, they would just pass that FHIR bundle straight through, and the response would be the FHIR claim response bundle. So we get the response. It's either approved, denied, or pending. If it's pending, we have to have a way to eventually get the answer, which leads us to the next slide, which is subscriptions. And so with subscriptions, this is the FHIR-based way of determining what the ultimate answer will be. It's based on the R5 type subscriptions. And so an organization or a provider can submit a subscription resource that details that it wants to receive all the prior authorization responses sent to a specific endpoint. And at that endpoint, then they can monitor all the responses that come back and alert their people on the final answer for prior authorization. Now, in addition to subscriptions, if that prior authorization request goes across and then the payer determines they do indeed need more information that they haven't already asked, they can utilize CDex in order to get that additional information. So CDex can be utilized to look into the response, determine that there's a LOINC code for a specific document they're asking for, and then that document can go get fetched from the provider and sent back to the payer. Or it could also be utilized to launch the DTR app, as can be seen in that top blue box on the bottom part of the slide, which would allow the same DTR process being used to submit additional information that is needed at this point in the process. And then on the next slide, we've got kind of a more technical diagram of how we achieved this at one of the particular connect-a-thons, where we looked for a 278 response coming back. Within that, if we identified a LOINC code that was for a particular type of document, we would then create a task resource to kind of document or audit what we're doing. And then within that, we would also go and try to retrieve that particular document from the FHIR server. If we found the appropriate document, we would send that back to the payer using the submit attachment operation, and then complete that individual task. And update it in the FHIR server so that the task kind of keeps track of what happened, and then the CDex process is used to update the payer with the additional documentation that they need. All right, so let's go to the next slide. And this transitions us away from burden reduction. So we've gone through the burden reduction implementation guidance and talked about the 4 different implementation guides there. Cognizant and Infor are also collaborating on gaps in care specifically, which is under the DEQM implementation guide. And so we'll talk a little bit about that as well. So within DEQM, there's kind of 3 parts to the DEQM implementation guide. The first is data exchange. When you're doing quality measures, how do you exchange the data that you need to do those quality measures? The producer can either submit the data directly to the consumer. The consumer also has an operation where they can go and collect the data, or subscriptions can be utilized. And for the actual reporting, the reporting is done with the dollar evaluate measure operation. It can be done for individuals or for summaries or for patient lists. So once you have that data there, you can run the appropriate reports. And then kind of the third thing within DEQM is the actual gaps in care, which identifies gaps in care that the patient has, that they need to do but haven't done. And so we'll talk more about gaps in care. On the right-hand side of this slide is a diagram that kind of dictates how gaps in care works. So a patient would present at a provider. The care management system would then gather the appropriate information to submit that care gaps operation that gets sent over to the payer. The care gaps operation would be sent over to the payer with the appropriate parameters, and then the payer would run the analysis with the data that it has to determine if there are any gaps in care, and respond back accordingly to the care management system, which would then parse apart that data, figure out whether there's any gaps, and then figure out how to act on those gaps. Next slide. And this slide kind of dictates the 2 parts of gaps in care. And when Infor and Cognizant were working together to solve Da Vinci implementation guides, there was kind of a clear delineation where Infor had the technologies to do the client side, and Cognizant had the technologies to do the server side. So it made kind of for that perfect match with regards to gaps in care. But so what is the client side and the server side? The client side is the side that triggers the workflow, the patient showing up, the gathering of the data and submitting the request over to the server side, and then parsing it apart when it comes back. The server side is the one that stores the data, continually collecting that data over time, performing analytics, generating reports on that data, and then providing those reports to the people that need them. So the next slide then talks about specifically with regards to client-side orchestration. So what specifically is happening on the client side? And this would typically be a provider, but as we'll see in the next slides, it can be a variety of roles that use the client side. But in general, the client side is going to look for some type of trigger, like a patient showing up, or maybe it's a list of patients that gets processed through at a regular interval. But there's some type of trigger that triggers this gaps in care process. The client side can also collect data and submit that over to the server side. It formulates the request once the trigger happens, sends it over, accepts the response back, and then figures out what to do with that response, parses apart the data, and then enables its clinicians to make decisions based on the data that has been sent back. And additionally, the client, if they get a gaps in care report back and they know that they've done some of these things, they can also submit additional data to the server side then to kind of prove that they've done some of these things as well. And then for the server side orchestration, the server side is going to be responding to the client. It's the one that is continually storing the data and hopefully has that comprehensive set of data that it can utilize to respond to the operations that are coming at it, analyze the data, run the appropriate operations internally on its server to generate those reports, and in the case of gaps in care, send back the gaps in care response. And then next slide. And then this gives more information about, in general, who are the people that play a part in DEQM or specifically gaps in care. So I've been kind of using the example of a provider and a payer. That doesn't necessarily always have to be the case. When you talk about a client side, they're the ones that are producing the data. So they're typically referred to as the producer role. And that client side producer could be a provider, it could be a value-based care organization or other organizations that are involved in handling care. On the server side, we would refer to those as roles as consumers or reporters. So they could be organizations such as payers, but also HIEs and public health, or even a consumer or reporter could be internal to the provider where they're running their own reports instead of going externally to get those reports. So consumers could be, and reporters could, align to lots of different entities playing that particular role. And then finally, receivers would be those that are using the server-side technology to receive reports. And so this would typically be payers or quality improvement organizations or anybody who needs to receive reports on quality measures or gaps in care. And so that's a summary of DEQM and gaps in care, those implementation guides, along with what we already did in burden reduction. So that's the overview of kind of the things that Cognizant and Infor are working on together. And so, I got ahead of myself. Let's talk about burden reduction in particular and who benefits. And so it's kind of a win-win-win with regards to benefits. The patient benefits with burden reduction because it has the patients receive quicker care. They don't have to wait around and stress out as to whether prior authorization is going to be approved or not. They can get that quicker response and then continue on with their care and get care quicker, resulting in better quality. And then the providers, this is where kind of burden reduction, the name comes in to relieve a lot of burden reduction on the providers. This has to do with backroom cutting and pasting, and phone calls and faxes and all the things that go into collecting the data currently with regards to the prior authorization process, with the burden reduction implementation guides and all that data being FHIR and structured. It hopefully will eliminate the data entry errors that happen sometimes as well. And so a big benefit to the providers, and then similarly a big benefit to the payers. They're not sorting through PDF documents and portals to make decisions. They get structured data, hopefully in most cases, that allow them to make quicker and more efficient decisions with regards to prior authorization. So next slide. And there are some early adopters of electronic prior authorization as well. Those are documented here and referenced here. But in one particular case, before automation, the provider was doing 3 to 5 prior authorizations per hour, and then that more than tripled for the 10 to 12 prior authorizations per hour afterwards. In another case, the cost went down substantially. From $8.04 to $2.25, so more than a 3x reduction in cost as well. But probably most importantly, and the one I like the best is last on the slide, is that 94% of patients experience care delays attributed to the prior authorization process beforehand, but then afterwards, 89% of the time, no prior auth was even required. And that means that the patient can just move on and make decisions immediately, since prior authorization was determined not to be even required. Next slide. And with that, I'm going to turn it over to Allison. That wraps up the standards portion of the presentation.
Perfect. Thanks, Rob. Hi, everybody. My name is Allison Slate, and I work for Cognizant on our portfolio strategy team. And I'm really excited to talk to you today about how Cognizant and Infor are working together to produce this new links or chain link slide of how data can be exchanged between payers and providers. So on the left-hand side of our slide here, we have our providers represented. On the right-hand side of our slide, we have our payers represented. And in the middle here and kind of across the top and across the bottom is really the chain link or how data goes from the left to the right. So on the left-hand side where we have our providers initiating these transactions, and a big portion of these implementation guides, and as Rob has talked about, is the burden reduction to providers. And so a big portion of what we're going to talk about today is how providers can initiate these transactions directly from their EHRs, EMRs, or practice management systems. And so starting there is where these transactions or requests are going to begin. The provider has the ability to initiate these requests directly from a piece of technology that they are already working in. They don't have to go to the fax machine. They don't have to go to the phone. They don't have to log into any number of various different portals that the payers are offering them to connect to. So working directly in the application that they are already spending a majority of their time and working in. The second link in our chain is going to be the provider integration technology. And this is really where the first portion of what the Infor partnership looks like for Cognizant. So the ability to integrate or connect directly to provider technologies, EHRs, EMRs, is using something specifically with burden reduction called Smart on FHIR, right? And so Smart on FHIR framework and an application is really the ability to plug into an EMR to help facilitate various transactions that we're going to talk about today. And so Infor, as Rob mentioned, really had the technology on the client side, where there's the ability to plug into the EMR and facilitate that provider workflow, right? Going into the EMR, gathering information, displaying a user interface that they can leverage to request or initiate these various transactions is really where that Infor partnership comes in, and what that really important chain in our link in our chain comes in. On the right-hand side, everything in blue is going to be supported by Cognizant. Cognizant is in both the provider and payer spaces today. So you'll notice that middle link here is our clearinghouse or FHIR intermediary. So today, Cognizant has an existing clearinghouse that processes EDI transactions, and they're in the process of enhancing that to be able to support FHIR-based transactions, so becoming a FHIR intermediary. We then get into the FHIR interoperability gateway, or specifically when we're talking about the burden reduction rule, is the electronic prior auth or EPA functionality. So we have a solution, which is what we connect with Infor, to bring this whole chain to life here. And we're going to talk about that a little bit more in the demonstration. But within the Cognizant ecosystem, we want to attack this from a beyond compliance perspective. So really focusing on accuracy and how can we facilitate in our chain to give providers actionable insights and information that can then be used to reduce burden and positively impact downstream processes. So we'll talk a little bit about that. And then the final link in our chain would be payer core systems. So this includes claim adjudication systems. This includes utilization management, care management applications, which we heard mentioned in the gaps in care DEQM section of Rob's presentation. And really, this is kind of what I would say is the furthest most right point for our payers to be connecting to. And payers have a large variety of applications to manage all of these various different types of transactions and to manage their populations. And so together, we bring this entire chain to life, leveraging our partnership. So really Infor bringing us together on that provider side, the ability to integrate with EMRs in a variety of different ways to meet providers where they're at, and then Cognizant really bringing the right side of this chain together on the FHIR server side, specifically for burden reduction. So what I'm going to go ahead and do is get into the next slide, which is going to showcase what are we going to demo for you today. So Rob talked a little bit about on one of the last slides there about the opportunities that are there for patients, providers, and payers by implementing the technologies that we've been talking about today. So to think about the return on investment for investing in a solution or having a solution that helps facilitate these various different transactions is there's going to be a lot more transparency in the industry. So between payers and between providers, the ability to be transparent between the two of those stakeholders on authorization requirements and documentation needs is really going to help change the industry, right? RFIs today and requests for informations are very manual and they take a lot of time and effort. And so the ability to be transparent up front is really a fantastic opportunity to start the reduction in burden for both sides. The second opportunity is to have an interactive information gathering process. So leveraging a Smart on FHIR application, which again, I'll show you today, really allows you to automate that RFI process of asking for additional information. So Rob talked about both standard and adaptive questionnaires and the ability to gather information related to a prior authorization. And so in that first step, payers are able to be transparent with their providers about the type of information or if an authorization is even necessary. But in this second step, we actually automate or facilitate an interactive gathering session between the provider and the payer applications on what information do they need to actually render that decision. The third part of this is integrating the authorization decision processing. And this is really that third part of the third implementation guide that Rob talked us through, which is PAS, or Prior Authorization Support. And this is the ability to automate the decision-making process. So today, prior authorizations could be submitted in a portal fashion, phone, fax, 278s, and a number of those are either batch processes or very manual processes. And so by being able to initiate these transactions directly from the provider's technologies like their EHRs, EMRs, or practice management systems, there's the opportunity to provide more real-time feedback to providers at the time that that request has been made. And so payers have the opportunity to leverage automation within their utilization management applications. Intermediaries have the opportunity to add automation to really support a more real-time process related to the decision submission or the authorization submission related to the decision processing. So the use case that we are going to take you through today is going to go all the way from CRD, the coverage requirements and discovery process, through DTR, documentation, templates, and rules, and PAS, prior authorization support. So we're going to start the process off. As a reminder, Rob talked us through those three workflows, but CRD is really going to help us figure out whether or not an authorization is even necessary. Should we move forward in this process? The DTR process is that interactive information gathering process that we're going to leverage the Infor Cloverleaf Smart on FHIR app. So that red box or that red link in our chain. And then we're going to actually submit the authorization directly to a utilization management application. And that's going to take us through the PAS process, where we're going to see the ability, as we walk through this demonstration today, really how efficient this process can be for both payers and providers, and the opportunities that we have to capitalize on those return on investment considerations on both the payer and provider sides, leveraging this type of technology. So I'm going to go ahead and close the PowerPoint here for a second. And I'm hoping everybody can see this CRD generator. Is somebody able to confirm that they can see my other screen?
Yeah. Allison, I can see it.
Okay, perfect. Thank you so much, Alex. Just wanted to make sure. So what we're looking at today, or for the first part of our demonstration, is the Vinci CRD generator. This is essentially a tool that Vinci has made available for us to emulate the provider's experience going through a couple of these transactions. So imagine that we have our provider hat on, that we are working in our EMR or EHR, and we are looking for some information on whether or not our patient needs a prior authorization and whether or not to actually move forward in this process. So the use case we're going to take you through today is for my patient Raymond for a total knee arthroplasty. So I'm going to go ahead and select my request. And over here on the left-hand side, I have the demographics of my patient. So I have the name, their age, their gender. You'll also notice that we have the service code. So this one in particular is a CPT code. And then over here, we have information that was gathered using prefetch. Prefetch is essentially a way to make my request whole. So I can't simply just submit a CRD request with just the name and the age of my patient and what service code. I need to have some more information related to Raymond's coverage, who the provider is, and additional information to actually make this package whole so I can submit this request to the server side. And this is where we jump into the blue portion or the blue links of our chain. So the first thing that I'm going to go ahead and do is click Submit to CRD and display cards. And when I do that, it is entering into Cognizant's FHIR server prior authorization solution. And we're doing a number of things here that I had mentioned on that chain link slide, where we are accepting the transaction from our CRD request generator. We are doing some translation capabilities. We are determining whether or not a prior authorization is needed. We're determining network status, and we have a special card here just to kind of give you an opportunity to view what is possible with CRD cards or system actions. And that is to be able to communicate information like, hey, this service is delegated. You can actually link out to something. So CRD cards are really flexible in how you communicate information with your providers. So once I did that, we can see here that we got some cards here on the right-hand side. This is telling the provider that their patient is eligible, that authorization is required, their performing provider is in network. And this is just giving information to the providers as they're going through the process, ideally from a use case perspective while they're sitting in the room with their patient. This is also where, when Rob talked about the CRD use case, where the provider would be notified when an authorization is not necessary. And from a burden reduction perspective, that is really the first really big opportunity to reduce burden using this type of technology, is that being able to give an answer to your providers on whether or not an authorization is required. If the answer to that is no, and that patient can go on and receive a service and start getting their medical care, the patient is going to benefit greatly. The provider is going to be really thankful that they don't have to go through that process. And from a payer perspective, they are not getting an authorization that really isn't necessary. They can spend time on authorizations that really need their attention and better manage their population that way. So the next thing that I'm going to do is click Submit to CRD and launch DTR. So we are now leaving the CRD process, and now we're moving into the DTR process, where I'm going to enter into the information gathering phase. And so what you'll see, this is when we enter into the Infor Smart on FHIR application. So our red link in our chain. That allows us to initiate some of these transactions or some of these experiences with the provider's technology. So what you're seeing is a questionnaire, and this was pulled from the FHIR server or from the Cognizant solution and displayed in the provider solution or in this Smart on FHIR application that Infor is offering. So this is asking me a question about the total knee arthroplasty that I have requested. It's a select all that apply. There is certainly the opportunity to go into the adaptive functionality here today, where we would be able to see multiple questions, or based on the answer from this initial question, what is my second or third question that I need to answer? Today, we only have one question, and we're going to go ahead and move forward into the PAS process. So as a provider, once I have answered the questions that a payer has returned to me, and transparently told me, hey, this is the information that I need in order to render a decision on the authorization you're going to be submitting, right? This allows us to be transparent up front, and as a payer, receive this information when that authorization is submitted. So I'm going to go ahead and click Submit. And what this is going to do is it's going to save the questionnaire, and it's going to submit it to our PAS endpoint, or prior authorization support. As a reminder, the PAS process is really the ability to submit the authorization directly to the payer application. This allows providers now to submit attachments and supporting documentation along with their authorization request, whereas historically, 278s are separate from 275s. There hasn't necessarily been a really good opportunity for a real-time interaction for the provider to submit the authorization, inclusive of all of the information that a payer needs to render a decision, and then receive a real-time response back from that payer on whether or not the authorization has been approved, denied, or pending. So you'll notice that this popped up with prior authorization status. I'm going to go ahead and click that. And that is going to bring me into a screen that's going to display the authorizations that I have submitted through my Smart on FHIR application. So you can see that our authorization that we've submitted with that service code that we saw in the CRD generator has been queued, and it's currently in a pended status. So this gives me a real-time feedback if the payer's application had automated business rules to automatically approve an authorization. The provider would be immediately notified, kind of as we've been talking here today, that their authorization has been approved. So again, really just getting into the opportunity to allow patients to receive care a lot faster, for patients to receive care a lot faster, for providers to receive more transparent information from their payers, and for payers to give information to their providers that's going to make their process easier. So I'm going to go ahead and pull my PowerPoint back up here and talk about a few lessons learned that we've experienced as going through this process of integrating Infor and Cognizant together through these various transactions. So the first one I want to talk about is the flexibility of FHIR in variable interpretation. So these implementation guides just simply cannot cover everything or every possible thing that might come up from the type of data that's sent, the necessity of whether or not a downstream system needs a certain kind of data, or the type of data that that downstream system needs in order to process the transaction, and really just the interpretation of the implementation guides or FHIR in general can be a little bit variable. And so when we first started doing this implementation and this proof of concept, Cognizant had one point of view, Infor had another point of view, and though they weren't vastly different, there certainly were things that we had to take into consideration and really kind of talk through and come to an agreement on what is the best way for us to move forward on interpreting or leveraging this kind of data. The second piece here is the importance of perspective. So Cognizant and the solution that we have been building is mostly on the payer side or the health plan side. Infor really specializes and has spent a lot of their time and effort building on the provider side and the client side. And so it was really important for us to have the ability to exchange information and perspectives from payers and providers. So for instance, how would a provider enter in this information? How does a payer expect that information to come into their system? Some of this includes like code sets. So providers generally use clinical code sets in their EMRs today, like SNOMED, whereas payers or health plan applications are generally using billing code sets like CPT, ICD, HCPCS. And so it's one of those things where you got to make sure everybody's speaking the same language in order to come to a shared conclusion. Another example of this was Smart on FHIR app launch. So again, it's written in the IGs. There's certainly perspectives there, but we did not really, from a Cognizant perspective, have the information within our walls about what this Smart on FHIR app launch looks in the context of an EMR. And so the ability to understand how is that going to work going forward, how does the provider expect it to launch or expect it to look, that information is really helpful for us. Another thing to talk about is the readiness of CDS hooks. So solutioning outside of the box to meet providers where there are is something that Infor offers, and that is simply because not every EHR or EMR is going to be ready to support all of the technology requirements in order to, support Smart on FHIR app launch out of the box on day one. And so Infor has a lot of different perspectives on how can we get providers up and running, because a big portion of this is to meet providers where they're at today, so that way they can adopt these workflows and transactions when payers are mandated to be doing this. So we really have to have two walkie-talkies that are talking to each other in order to see the burden reduction goals of what this is going to come out of, or see our patients receive faster care. And so making sure that we were able to exchange information or have shared perspectives on what's happening on the provider side, what's happening on the health plan side, and that has really helped us a lot. The next one is to fail fast and respond iteratively. I think this goes without saying that any proof of concept, you're going to run into bumps in the road. And so what we identified is there's certainly a lot of opportunities to fail fast and be able to make changes very iteratively. This is something that was very important to both of our organizations. And so by using the perspectives and especially with the flexibility in FHIR, we had to be flexible. We had to fail very quickly. And so with that comes testing. And so here's our little commercial for Connectathons to align your development process with the partners that you are working with, and also to look at the Inferno testing tools. These are a little bit newer, but are certainly going to be very helpful. Kind of in line with that is the trebuchet testing. So you don't know what you don't know. It just kind of a matter of fact thing. And so it's really important to get as many people as you can in a room to share perspectives, to test things out, to go through real life use cases and workflows. And so again, another little commercial for the trebuchet testing activities. Both Infor and Cognizant are involved in those activities. We're excited to continue to grow that. We certainly have opportunities to do so. And so this is a really great opportunity to really test out those real life use cases. Validations of assumptions at every level. So this allows us to validate our assumptions on both sides as we go through the testing. So things like, how does prefetch work? How does prefetch work on your side? How are we expecting the information in prefetch? What is the workflow? How do you expect things to be displayed? Things like that. This is a really good opportunity to validate the various assumptions that we have made in our development process. And then again, to go back to the fail fast and respond iteratively, that gives you the opportunity to do that. The last thing that we just want to plug is the usefulness of the 2 times a week burden reduction workgroup calls. These are a really great opportunity to collaborate, to talk, to share perspectives, to get your questions answered, right? There's certainly like the Zulip channel, but this is a really good opportunity to hear the conversation, ask good questions, hear what other people's perspectives are. And so those are a really good thing that we have been leveraging on our side to help us in this journey. And I'm now going to pass it off to Jamie to talk a little bit about how are we taking what we've done in burden reduction and how are we going to use it to shape where we are going strategically with some of those other implementation guides.
Thank you, Allison. Hello, everyone. My name is Janie Miller, and I also work for Cognizant on our shared solutions team as a solution owner. As Allison and Rob have mentioned, there have been really a lot of valuable lessons learned by both Infor and Cognizant as we've worked together around the prior authorization use case and those 3 burden reduction APIs. One of the cool things that we've experienced with those 3 APIs is there's really this opportunity to have this FHIR-based bidirectional, we call it conversation, right, between providers and payers. And we've seen the ability for that to be chatty in a real-time type scenario. And so really, in essence, we're trying to get at the right information at the right time in that real-time context. And the use of those adaptive questionnaires through DTR and through the interactive use of those 3 APIs really allows that to happen. And so we've seen that as an industry, we're really able to cut to the chase and get to that required data for those decisions that are really impacting the patient's care much faster. So ultimately, the burden reduction, eliminating much of the manual processes, the time lags, and some of that unnecessary miscommunications of information. So all of this to the mutual benefit of the provider, the payer, and ultimately to the patient. So now when we think about this new, really this chain link that Allison has talked us through, once we have this new flow of data in place between providers and payers, and we're leveraging it for, let's say, the prior authorization use case, we really have this foundational framework that's in place that we can continue to grow and expand and support many different use cases and many different FHIR-based end-to-end data conversations between providers and payers. And so we see this moving beyond prior auth to gaps in care and clinical data exchange and many more various use cases. So we're really excited about having that established framework that we can leverage and build more and more use cases and have that be the framework for that communication over time for many different purposes. As an overall solution, what we're trying to do is really facilitate this many-to-many type of exchange. And so we know that from a provider perspective, they're wanting to communicate with all the payers that they have that represent their patient base. And from a payer's perspective, they want to be able to effectively communicate to their entire provider network, regardless of what EMR or EHR system that provider may be working with. So when we look at it really from both of those combined perspectives, what we're trying to do is really intentionally design this end-to-end solution so that it can be system agnostic on both the provider side as well as on the payer side. And so we really try to approach it with the true spirit of interoperability. So for example, on the payer side, if a payer is using one of our Cognizant TriZetto solutions or backend application, then great, we can route to that as an endpoint. And we do have the opportunity to really create an optimized solution in that scenario because we have the developers from those products in-house and can leverage that knowledge and that expertise. But in the event that a payer is using a non-TriZetto or non-Cognizant application, then we can route to those endpoints as well, assuming that everyone is in alignment with the Da Vinci implementation guide standards. So to us, it's really important that we're really facilitating and making this more scalable so we can support this many-to-many type of exchange. One of the nice things about really conceptualizing this foundational framework as this link chain is knowing that it can be adapted, right? So if a payer was wanting or a provider was wanting to add a chain to this framework, so maybe they want to connect up with the TEFCA network for even more scalability to really access that network of networks, we have that flexibility. So that can be leveraged or not leveraged as desired. And so this is really the strategic direction that we're heading. So over time that we can really support more of these bi-directional FHIR-based real-time end-to-end data conversations. So as we look to supporting more scenarios around value-based care with member attribution, risk adjustment, patient cost transparency, SDOH, and more, we're able to leverage this foundational framework. Next slide, please. So with our solution, we, as we've discussed, we're trying to bridge this communication gap that exists today between providers and payers by really focusing on these moments that matter. We're having the right information at the right time in that healthcare decision context really is important. And so this visual just gives you an example depicting a gaps in care exchange. So we know that Rob had gone through the DEQM implementation guide, education around care gaps with leveraging the DEQM standard. And so what we're showing here is basically how information can be exchanged between the providers and the payers in a real-time exchange around two of the DEQM APIs, specifically $care gaps and $submit data. So if we look at this flow, what you'll see is really step one, the provider submitting that request for a care gap report for a patient that may be in focus on the provider side and sending that request over to the payer. Then the current care gaps for that patient can be communicated back within seconds from the payer to the provider, and the provider can then work with the patient to be able to close that care gap. And so that could be the provider or care manager or whoever may be receiving the information on that end. So once there is that gap closure activity, then they're able to submit that data of interest for that quality measure for that member back over to the payer so that the payer can certify the gap closure. And so you can see the use of these two APIs to be able to accomplish this data exchange in a very efficient near real-time scenario. So with the workflows, when we think about specifically the gaps in care use case, we know that one of the things that has been a challenge around that has been really just the latency, that's been involved. And so we're looking for opportunities to be able to reduce that latency. Working with NCQA, we know as they move over to these digitized DQM measures, we're going to have the ability to have more of this real-time identification of care gaps so that they can be communicated out to the providers and the care managers on a timely basis. And we know that with certain quality measures, some of them are very time sensitive and do require a follow-up to happen within a certain number of days after an event. And so we know that the timeliness of sharing this information is really important. And so if we think about some examples in that space, follow-up care after an emergency department visit or after a hospitalization for mental illness, we know that it's essential to be able to prevent the relapse and really improve the long-term outcome for those patients. So that's really what we're looking at when we're targeting these moments that matter. So whether it's behavioral health related or managing chronic conditions or ensuring that preventative services or screenings are happening, we really have this great opportunity to leverage these FHIR-based standards to be more proactive in not only closing the communication gap, but hopefully ultimately closing those care gaps for those patients. You can advance to the next slide. So as we mentioned, Cognizant and Infor are working together to create these end-to-end data conversations. And having this chain link data flow in place, we're going to be able to leverage it for these additional use cases. One of the other things that I wanted to point out here, which we're excited about, is the ability to have these subscription-based notifications between payers and providers. And so thinking of a couple specific examples of when that would be really effective is if we think about even the prior auth use case, if the initial prior authorization request ends in that pending status, it may take a couple business days for the payer to ultimately render their decision. And so in that scenario, providers can sign up for notifications such that when the payer does make that decision to hopefully approve that prior authorization request, the provider can be notified then in real time when that prior authorization status changes. And so they're not having to just, reach out on their own time, checking the payer's portal or calling into their customer service line or just repetitively trying to check in on the status, where we can have that sent in real time at the moment that the status changes back over to the provider. And so by having that proactive notification, then the provider can then move forward with scheduling the necessary care for the patient, and we've really had another opportunity to reduce the lag time. We know that subscription-based notifications are also going to be a great tool for other use cases as well. So if we're thinking about care gaps, and we know that on the payer side, if there is a newly opened care gap that needs to get communicated out to the provider or the care manager, that those subscription-based notifications can really effectively communicate that, as well as if a care gap gets closed, maybe there is another organization that's worked with the patient to be able to close that gap, or maybe that there's an adjudicated claim that's come in that has resulted in the gap closure. Having that information be able to be communicated out to all the stakeholders really ensures that we are keeping everybody in the loop and giving everybody that important information. So, as we've talked about, Infor and Cognizant have decades of experience in these payer-provider transactions. And so we really are excited to be able to work together to help build these types of solutions. On the provider side, we know that Infor is working with 1 in 3 hospitals across the United States and has over 5,000 healthcare customers. So on the Cognizant side, we also work in the provider space as well with our TriZetto Provider Solutions Clearinghouse. They're handling over 3 billion communications annually. And we, through them, also have over 8,000 payer connections. So we really have that depth of knowledge on the provider side, both with working with Infor and Cognizant. And then on the payer side, we have approximately 50% of the US insured population is supported by one of our payer core administration systems. We have over 80,000 associates that are dedicated to healthcare. And so I kind of paint this picture just to be able to say that we really are in a unique position to really make an impact. And so our organizations are investing heavily in this area and in supporting this framework and these FHIR-based transactions. And as we view that, we don't just look at it as an opportunity. We really are wanting to find ways, really almost more from an obligation perspective, because we can do something. We feel like we need to, because we all have had the frustration, felt the friction of working in this complex, fragmented, broken ecosystem for so long. And we want to be part of the solution. So we want to roll up our sleeves. We want to have these experience with other industry leaders who are leveraging FHIR and these standards to be able to do these types of data exchanges. And really, like Ali had mentioned, really fail fast, right? And have those lessons learned so that we can really get these transactions into production. So that's what we're really excited about, being able to work together, not just with Infor and Cognizant, but also with the broader Da Vinci community to really be able to modernize the whole healthcare experience for everyone involved. So I think that's the end of my part of the presentation. I will turn it back over to you, Alex, if we want to open it up for the Q&A.
Awesome. Thank you so very much. We hope folks will put some additional questions into the Q&A box. We do have a couple in there, but before I jump into those, I think it's really interesting to hear the journey that you've been on and how you've taken your respective capabilities around FHIR and then are building out a strategy, if I've heard you correctly, that really is helping you to take some core capabilities that you have, and then as you've gotten those into place and have proven them out, you're adding on top of that to really reuse those capabilities, and which means that you're hooking into providers, hooking into payers, and that just creates this conversation layer that over time becomes deeper, if I heard you correctly, for all the different kinds of exchange purposes that we may have, the use cases that need to traverse between that payer and provider clinical shared workflow.
Yes, absolutely.
Yeah, so it sounds to me like you're really harnessing the base capabilities of FHIR and the mix and match opportunities. So I just think that that's sometimes folks, I think, forget that once you've installed some of these capabilities, that they are really leverageable downstream for other functionality and garnering further burden reduction. So let me go ahead and ask the first question. I think I'm going to ask this to Allison about how did you handle the issue of different code sets between payers and providers? Does a crosswalk occur? And if so, where does it occur in the data flow between organizations?
Yeah, so thank you for the question. Within our solution, we function as the EPA coordinator. So translation capabilities or the crosswalk capabilities is a part of our solution. It's something that would mostly be handled on the health plan side of determining what is that crosswalk between the clinical code sets or SNOMED to the billing code sets. As part of the CRD response, we also include what did we translate that to? So making sure that the provider is aware of, hey, we took 1, 2, 3 and made it ABC. So that way, when you get to the downstream processes like claims, you're submitting claims, you're billing for a specific service, you're aware of whether or not we said, hey, no authorization is required for ABC. But if you submit DEF, we're not really entirely sure if that's going to, completely align. And so making sure that not only are we handling that crosswalk kind of on the health plan side, because that's where a lot of our processing is happening in the downstream systems, but also making sure that we're being transparent with the providers on the response back about what that translation was, so it doesn't get them tripped up later down the road.
Thank you. We have a couple questions around TEFCA. So if maybe I'll lob this initially to Rob, and if others want to chime in, certainly feel free to do so. Let's start out with the question around how do you see TEFCA playing a role in your prior auth solution? And are you actively connected, or do you plan to be in the future, with an opportunity to really also talk about how the features that you showcase today fit into a TEFCA world or not?
Right. Yeah, that's a great question. And I think a lot of that will play out. I'm familiar with the TEFCA roadmap. I've read about, their progress amongst, I think, the 4 stages, and certainly they will be able to handle FHIR APIs. I see TEFCA as it's the national network that is more of connecting the parties on both sides, but not necessarily a lot of the value add components that we've talked about. So in particular, the Smart on FHIR app, or the X12 conversion, or maybe the CDex part, or subscriptions. When you look at the burden reduction workflows, and really all the Da Vinci workflows, you're looking at a lot of orchestration amongst several steps. And I think that orchestration has to take place on the side that is doing the communication. TEFCA, I think, definitely can be used with our solutions as that kind of network that can get data from point A to point B. But I think on both sides, you have value add things that need to take place, like I mentioned, that can manipulate the data, collect the data, generate the questionnaire resources, generate the Smart on FHIR app, all those types of things that I don't know if TEFCA is going to get involved with those details. And I'm not a TEFCA person, so I don't know for sure, but that would, that's kind of how I see it, as TEFCA being more the highway that can help connect points on either side, if necessary, if you want to use your QHIN and the TEFCA network to do that. But there's still lots of work to be done on either side to handle the implementation guide workflows.
Allison or Janie, do you want to weigh in on that at all?
Yeah, I would just say, from our perspective, we're really trying to meet our clients where they are, whether on the provider side or on the payer side. And so we are, as I mentioned, when we were looking at the link chain, to us, that opportunity to have that QHIN connection is an optional link on that chain. And so if we have customers and clients that are interested in leveraging that as an on-ramp for their traffic, we absolutely want to support them in that, and we will have that as a QHIN connector that they would be able to add as part of that framework. So it really is going to be up to what's in the best interest of the clients and what they're trying to accomplish.
I think that's a really good point, Janie, is that we have so many historical technology investments and operational decisions that have been made over the years. Everybody's sort of in a different perspective, and that has to be, or a different situation that needs to be accounted for. And so industry is going to have to make some choices about which environments they choose to play in to get their data to traverse the super information highway in a secure and automated way. So I have another question that's come in. And it is related to whether or not you've seen any electronic health records indicate they will develop electronic prior authorization functionality within their user interfaces that could negate the need for Smart on FHIR apps. It's a little bit of crystal balling, but maybe you have seen this in the community.
Right. Yeah, I mean, I've definitely seen that at Connectathons, where there are some EHR vendors that are starting to develop their own functionality that they would have internal versus using something that might be in their Smart on FHIR app. I think that, will remain to be seen for each EHR vendor. Do they want to build something in their own solution and have control over it, and so that they do their own development internally, versus opening up their app store and just saying, pick your favorite app in our app store. We're not doing it. You can choose your favorite app and do it. Maybe they white label something and put it in their product. So I think each EHR vendor will make their own decision on that. But yeah, I mean, I think it'll be a mix.
Allison,
Yeah,
do you
and
want to weigh in on this?
yeah, I was just gonna add to that. I think some of the other I think sometimes we get caught up in thinking about a lot of the big box EMRs, EHRs, and practice management systems, but there certainly are a lot of provider facing applications that are out there. And so some of the feedback that we've also been hearing is that they want to develop this technology natively, but I'm sure as Rob can attest to, it's not a small feat, right? And so some of the feedback that we've heard is that some of the other EHRs, EMRs that are in the industry are excited about building this, but they don't necessarily think that they're going to have time to do it by the time that payers are ready for it, or they don't have the resources. And so a lot of their strategies are maybe starting with Smart on FHIR apps or leveraging those as they learn about the implementation guides and the technology, and then be able to build some of that stuff out natively. So I think just directly in line with what Rob had said, I think there's a mix for sure. But we also see there's also kind of a short-term, long-term strategy that some of them are taking as well.
Thank you for that perspective. It definitely takes a village to design the specifications based upon real workflow experiences and pain points that are encountered, and that it's great to see the level of engagement with the use cases, trebuchet and testing, really to get to that, as I think someone said earlier, I think it was you, Allison, the spirit of interoperability, that capacity to really meet the providers and the payers where they're at in support of the patients, and really getting them the quality care and the information flowing around them so that they get the services that they need. And so we're really grateful for your participation in today's webinar. Thank you for coming and sharing your journey. We look forward to future updates from the Infor and the Cognizant team. And I hope everyone will have a great rest of your day. And we'll see you at the May 28th Community Roundtable, and hope you'll complete the survey at the end of the event today. And thanks for joining us.
Thank you, everyone. Thank you, Alex.